is our first video from Homage. The reason why we are doing this video is because we've been getting a lot of inquiries from our care recipients, even care owners themselves, on certain medical conditions. Our intent here is to really share certain general awareness on certain conditions so that we know what to expect, or what are the sort of treatments you can get, especially from home. But again, this is just general awareness. If you do feel any pain at all or any of these symptoms, please consult the closest doctor near you and also the hospitals near you. With me today is Andrea. Andrea is our in-house nurse. She's based in Klang Valley. She brings with her 10 years of experience in countries like in Saudi, Singapore, and now she's back at home here to treat our Malaysians. She's specifically in a stroke unit. Yes. Okay, so for this video, we would like to understand a little bit more about stroke. So maybe Andrea, if you can share with us, what is stroke?
Okay. Stroke is actually when your blood supply to the brain, there's a disruption there. So meaning you have like a blockage or a clot, then that's when the stroke occurs. So that's depending on what type of stroke you are going to get. So
I see. Is there like something that I could feel that it's coming, or are there any symptoms that I know of?
Yes, usually when someone has a stroke, the first foremost signs that you can see, we use F.A.S.T tool, which is F.A.S.T. F stands for face. You can see either side of their face is drooping. Maybe when they smile, their eyelids, their nasal labia fold here is drooping, their eyelid is drooping. That's one of the signs. F. Then A is their arms. When you ask them to lift up their arms, it actually drifts. Yeah, you ask them to hold for 10 seconds, it will actually drift one side. Yeah.
Oh, okay.
Yeah, and then speech, S is for speech. Speech, when they are speaking, is actually slurred speech. So you can actually tell that they are having slurred speech compared to a normal speech. Like how now I'm speaking is normal. So they will have slurred speech. Yeah, and then time is where you say time, you have to note down the time, what time you notice these symptoms, and then you will need to call the emergency ambulance.
Okay, so I think for this F.A.S.T, the easiest for me to see is really the arms. So how often do I need to just check on myself to make sure that I'm okay?
Oh no, so like example, if you are out with your friends or someone in the public, and then you will, the very obvious one you'll notice is their face.
Oh,
yeah, you can see their eyelids or their nasopharyngeal fold here is actually drooping.
I see.
Yeah, or when they're drinking water, they're drooling. And then you can see they unable to lift up either side of their, if it's left side, you can see the whole left side, the weakness. So you ask them to put up their arms, hold for 10 seconds. So if 10 seconds you see them drifting, it's very obvious. You know that you're having a sign and symptom of stroke.
So say for example, if I'm having a coffee with a friend and if suddenly I see her left side example starts to droop, do I have to follow the F.A.S.T straight away, or can I just conclude that, oh, something is happening?
Yeah, you can actually visibly see the F.A.S.T. The F is for the face. You can see the drooping already. Then the arms, you can, if you can see that she's having weakness. Some people don't have that weakness. If they have like the mini stroke, they might, it just will be there for a while and then it will just disappear. Okay. So it's still best to seek medical doctor's advice. Go to the nearest hospital you can. Note down the time. What time did this happen? What time did your friend notice it? It's very important to know the time.
Okay. So say for example, if this situation quickly escalates, is there something I can do immediately?
For you to do immediately is to call the emergency, the ambulance. That's the only immediate action. Yeah. Do not give them things like, I know some people say take aspirin or because you don't know whether they're having a bleed or a ischemic.
I see. Okay. So again, I just want to make sure that this is just a general knowledge that we should equip ourselves with. But if you do feel any of these symptoms at all, please go and see the nearest doctor or go to the nearest hospital. So let's go on to the second part. If let's say a person is diagnosed with stroke now, what sort of therapy or treatment they usually do in the hospital, and if after that when I get discharged, what can I do at home?
Okay, so when you noted all the signs and symptoms, they'll send them immediately to a hospital. In the hospital, they will do all the scans, radiology scans, CT scans, if there's no bleed, MRI, and then if it's ischemic stroke, they will see treatments like maybe they need to give you altiplase, it's a clot blasting medication. Yeah, those kind of medication, it's only given in the hospital. So they will see if you fit the criteria, this criteria list. If like you are 80 and above, they will not do those kind of things. And then they will monitor you for 3 days.
Or in the hospital?
Yeah, in the hospital. So 3 days they'll monitor depending on what type of stroke. Then again, because you have ischemic, hemorrhagic and TIA. So if it's ischemic stroke, they will monitor you, they will see how's your heart rhythm, they will do the echo scans and all that. And most of the stroke patient, not most, I can say all, maybe 98% of the stroke patient, they will need a continuous physiotherapy or occupational therapy or speech therapies.
Oh, okay. What's the difference between, so I only know of physiotherapy, what is speech therapy?
Okay, so like for occupational therapies, physiotherapists and speech therapists, they are actually 3 different specialized themselves. So physiotherapists, they focus on your bone and your big major muscles and all that. For occupational therapists, they actually focus on your fine motor and some of them for your cognitive levels and all that. For speech therapists, they concentrate more on your speech and language and also your swallowing if you have impaired swallowing. Some people after stroke, their muscle all weaken, so they need a speech therapist to actually train them, those exercise, what to do, how to speak, like some things like singing or certain words. And if they have a certain type of stroke where it's their broca and vernix is affected, so they will have like difficulty expressing, so they call that, yeah, they have global aphasia or anything, so they will need like communication board. This will all be provided by the speech therapists.
I see. So if a patient is a stroke victim, is there any sort of recovery they can do from home?
Recovery like physiotherapists, speech therapists and occupational therapists, together with they have to change their lifestyle, their diet, everything. So in recovery progress, right, once they are really stable, then the doctor will discharge them from the hospital. So when they go home, they will always advise you to continue your physiotherapy. If depending on what type of weakness you have, continue your occupational therapies or continue your speech therapies at home. So they will give you like maybe 1 week once you come and see in the hospital, and then you go back, you train yourself, you do all those exercise and activity that was given, so you will be able to see improvement in your daily lifestyle.
I see. So with these therapies, will a stroke patient recover to almost normal like before?
Yes, if they continue to do all the therapy, depending what type of stroke again, because different type of stroke and their willpower. Because if some people they have bleed, they might not be able to recover 100% to how they was. They will be, example, if they stroke, there will be a minor difference in their lifestyle, because it's not like 100% recovery to how you was prior to your stroke. But you will there's still like something lacking here and there. But with continuous physiotherapy, occupational therapy and speech therapies, depending which one you need, you will be able to see improvement. It's like a daily improvement thing.
Okay. This video serves as a very basic information for general public. Again, if you need any information or if you feel any pain at all, please go to the doctors and go to the nearest hospital. If you would like to know more about any medical conditions, or if you have any feedback on this video, please let us know. You can always put it on a comment section. Again, this serves as a very basic information for everybody. Thank you very much for your time. Thank you, Andrea, for your time.
Thank you so much.